Lainey, thank you. Scientists in our own backyard pushing the boundaries in healthcare and cancer research.
Always nice to have them in our own backyard for sure. And now researchers with the Salk Institute say they have found a way to help patients better respond to cancer immunotherapy and help strengthen their immune systems. Joining us now here around the table is Dr. Diana Hargreaves, Associate Professor at the Salk Institute. So thank you for being here.
Thank you so much for having me.
Well, when it comes to cancer treatment, the vocabulary most of us are familiar with is chemotherapy as a treatment. We all know it ravages the body in the process of treating a patient. So explain what immunotherapy does and how it differs.
Yeah, cancer immunotherapy is really a revolutionary cancer treatment. It acts by firing up our own immune cells to kill cancer cells, and really uses the natural properties of the immune system to train the immune system. And for that reason, it can fight multiple tumors at a time. It can even train the immune system to fight recurrent tumors. And as you mentioned, it's also less toxic than many of the treatments we have, such as chemotherapy.
So is this what President Carter used when he had brain cancer about 8 years ago or so?
Yes. And so you can see how effective it can be. So my team and I are really excited about understanding how we can expand the use of immunotherapy for cancer patients. And that includes looking at mutations in genes that can really cause cancers to become more sensitive to cancer immunotherapy. And so the gene that we studied is the ARID1A gene. This is a mutation that is present in a number of individuals with cancer, and we find that this gene actually sensitizes cancers to immunotherapy.
And what do you mean sensitizes? Just makes them more susceptible to it?
That's right. So the treatment is more effective in patients that have an ARID1A mutation.
And so what does this mean for the future of cancer, not just research, but obviously treatment?
Yeah, so it's expanding the number of people that receive immunotherapy and also the tumor types that we currently treat with immunotherapy. And so the idea is really to get the appropriate treatment to these individuals.
I remember seeing the story of President Carter. You know, this is 91 years old. He has brain cancer. Like, oh, you know, it's terrible. And then, you know, amazingly survives. Here he is still with us.
Yes.
And you wonder, okay, that's been 8 years now. Why is this not more widely used? Or is it on the way to that at some point?
Yes, so one of the issues is that while immunotherapy is very effective, it's not effective in all cancer types, and we're still trying to understand why that is. And so that really drives us researchers to understand if there are certain events in the cancer that can really make them more sensitive to immunotherapy, like this mutation.
So what are the types of cancer that show the most promise in curing or treating with immunotherapy?
So currently, immunotherapy is very good at treating, for example, melanoma, but it has very little efficacy in things like pancreatic cancer, where it's really not used at all. And so the ARID1A mutation, however, is present in pancreatic cancer patients. And so this would really open that up. And so we're working with clinicians at UCSD to really start clinical trials, for example, in pancreatic cancer, to see whether this could be an appropriate therapy for those individuals.
It seems like a huge potential step forward here. What does the timeline look like? I mean, how's are we 20 years down the road and we look back like, I can't believe we didn't have this already, or we didn't use this widely? Or, what kind of timeline is realistic?
Well, I think it could be very soon, actually, because not only is immunotherapy an approved therapeutic, but ARID1A is also a mutation that is currently being screened. And so it will not take that long to put those two together.
Really fascinating, and it's so encouraging to have this brain trust in our home backyard. So Dr. Diana Hargreaves, thank you so much for sharing this latest research.
Thank you, I appreciate that.
Major developments. We look forward to following up and seeing what's next. Thank you so much.
Thank you.
All right, to San Diego.